After being diagnosed with stage 3C ovarian cancer, Carol got tough and took control along with her daughter April and founded the EllaCris Foundation for Women's Gynecological Cancers with the goal to connect with other women and educate them and learn from each other. Ovarian cancer. Many people have never heard of it yet. Over 20,000 women each year have cases of ovarian cancer in the U.S. alone. That is 1 out of 72 women, and the risk increases if one family member has had it. In 2014, there will be about 22,000 who will receive a diagnosis of ovarian cancer, and over half of them will die because of it. The rate at which women are diagnosed with ovarian cancer has not fallen quickly enough over the past 20 years. Experts yet don't know exactly what causes ovarian cancer. Many tend to ignore symptoms that could point to cancer, or younger women may have the notion that cancer is a problem of older people. This is not the case. They may ignore the symptoms of bloating, pelvic or abdominal pain, difficulty eating, or feeling full quickly, urinary frequency or urgency.
I started experiencing gas. At the time I chalked it up to you're getting older, you eat too much fiber. But when I think about it now, it was way more than what was normal. But I just didn't pay attention to it.
So I'm wondering if that whole year and a half of me having that little bit of discomfort, if that's when it had all started. And it wasn't until I had the bad pain under my ribs that they were taking a closer look. And it was the CT scan was the only thing that really kind of woke people up to say, wow, let's see what's going on.
My symptom was constipation. Now, I had it for at least a year because I'm told doctors consider constipation to be a benign symptom.
Continual urinary tract infections, at least that's what I thought they were. And it's put on probably 20, 25 pounds, and there was no reason for it. I wasn't eating anymore at all. And then I had a pain in my gut, bloating, energy level was rotten, and I'm a high energy person, so that was unique.
Running a low-grade fever. I felt very full, and I felt my stomach was very hard for about 3 months. Just kind of wrote it off as maybe being some sort of infection. But living a healthier lifestyle, I thought I would have less chance of it occurring, even though it was in my family history.
I had no symptoms. The ones of feeling full, any of those symptoms. I really honestly, and if I did, I didn't notice them.
Treatments for ovarian cancer are more successful with early diagnosis, but most of the time, it has already spread by the time it is found.
So I went down for a PET scan. Once again, a couple suspicious spots, but nothing saying, you've got it. And so then he had me, a diagnostic laparoscopy is what I was scheduled for. And I had a cyst on one of my ovaries, so he said, if nothing else, we'll just take the cyst off. But once he got in there, the cancer was everywhere. Stage 3C. And 2 weeks after that, I had my surgery done.
CA-125 is the most frequently used biomarker for ovarian cancer detection, despite ambiguous test results in some, though 90% of women with advanced ovarian cancer have elevated levels of CA-125 in their blood serum.
He told me that my CA-125 was high. That's a test used as a tumor marker, and normally if it's high, it can indicate ovarian cancer. And he told me that I had a 4-centimeter mass on my left ovary. And that was the day that changed my world forever.
It was not easily diagnosed for Angela.
Let's see, 2 physicals. I had 2 PAP tests. I had 2 urine analysis. I had a clean colonoscopy 2.5 years before my diagnosis. I had 2 clean CAT scans 2 years before my diagnosis. I had a transvaginal ultrasound a week or 2 before my diagnosis that was clean. I had an abdominal ultrasound that was clean as well. No one even mentioned ovarian cancers. What the primary care physician asks you at your annual every year is, have you gone for your PAP test? So I thought I was covered, and I think they did too. No one ever suggested ovarian cancer. I have no history.
Like Angela, many are in shock that it could happen to them. Rachel was surprised that she could get it.
I've never even heard of ovarian cancer, to be honest with you. I mean, we hear about, breast cancer. I know that. I mean, that's about the only one I really heard of.
As any person with cancer knows, a cancer diagnosis also affects your family members and friends.
Because she is my sister. I don't know what I'd do without her. I mean, literally, we are together just about 24/7. She's more important sometimes than a spouse. I can't picture my life without her. So it's really affected me. And my father, I think, the most. Because she's Daddy's little girl.
Brenda was diagnosed with ovarian cancer after an ultrasound.
I'll never forget when I went for that ultrasound. Normally the technicians are pretty eager to say, everything looks great. I'm not a doctor, but don't worry about it. This time when I had the ultrasound, she was very quiet. She didn't say too much. And I was feeling a little uneasy. And when it was done, I said to her, so no tumors, right? Just fooling around. And she said, I can't tell you that. I would get in trouble if I told you that. And I walked out, and I remember thinking, I think you just did. I don't think I'll ever forget that day. Or the minute, or when the phone rang, where I was sitting, what I was doing, what she said. I can replay everything like it just happened. And I just thought, I can't live without my mother. Like, what would I do? And even though, at that time, it was kind of like she had said, it was, everything seemed to the diagnosis seemed to get worse and worse. In the beginning, it was kind of like, oh, well, maybe you won't even need chemo. You'll just have the tumor out and everything's going to be done. Then it was in the lymph nodes, and it just seemed to get worse and worse and worse. My biggest regret was that I wasn't genetically tested when I knew my mom had ovarian cancer. Had I been genetically tested, I would have found out that I was BRCA positive, and I would have been able to take steps to avoid getting cancer. I made the decision a little over a year ago to have a prophylactic double mastectomy. The next step is to have my ovaries and tubes out. In the meantime, until I do that, I am having ultrasounds every 6 months, transvaginal ultrasounds, and a CA-125 every 6 months. I'm young. I have young kids. I'm a newlywed. How can I do this? And on the other hand, I'm young. I have young kids. I have a new husband. How can I not do this? So I would kind of say it was almost like being given a crystal ball to see something that you're really not even sure if you're glad you got to find out. Part of me thinks, thank God, I know and I have the opportunity to be proactive, and the other part of me thinks maybe ignorance might have been bliss. I'm concerned for my daughter. She's going to have to get tested to see if she has the gene. I feel the same way, about her. It's like, you want to know and you don't want to know.
After being diagnosed with cancer, you reprioritize your entire life. everything changes. I'm 55, and my oncologist told me a year ago, it's about time that you start living.
Emotionally, I am a mess. Many days I cry all day. I'm terrified of a reoccurrence. I feel that the onus is on me to know if I'm reoccurring. For me to hear these whispering symptoms. And really that's a burden that seems too much for me, especially in the state I'm in.
Education and raising awareness are key to combat ovarian cancer.
Information, no. You know, I was totally clueless, literally clueless about ovarian cancer, about the symptoms for ovarian cancer, you know, and I sit back and I think, well, yeah, I did have bloating, but who doesn't? Oh, I had this, but who doesn't? Again, putting them aside, not thinking, because I go to my gynecologist, do my yearly exams, I'm thinking I'm covered, and look, I wasn't covered. And I guess just, you know, just fight, and knowledge is power. And I always tell my sisters that now that we know better, now it's on them. And now my sisters are being tested, and they're going through all the testing. Now my nieces are being tested because I don't want this to happen.
They'll tell you that knowledge is the most important factor in all of our health. I did not have the knowledge. If the medical community had it, they didn't share it with me.
The thing that you can't do is not ask people how they are. They need you to ask them how you are, even though it may be not comfortable for them. Just to become involved, fundraising, helping people, making people aware. Education is number one. Educating yourself, listening to your body, educating people you love. It can affect your mom, your dad, your spouse, your partner, your kids, everybody. And it doesn't discriminate.
To be an advocate for yourself until you are comfortable and get an answer, to know the symptoms of ovarian cancer.
Don't stop until you get an answer, a diagnosis. If you're not pushy and assertive, you're not going to get your answer. You have to be what I call a biatch. You have to do it. If you want results, you have to.
I'd like them to know that it can happen to them. It doesn't have to be family history, that you need to listen to your body. And if you feel something's wrong, then something probably is wrong. It doesn't hurt to go and have it checked out. If you don't like the answers that you're getting, pursue it. You know, don't give up.
So listening to the whispers, if something doesn't feel right, make sure you get it checked out.